Everybody asking how we doing, say we good. Don't need no one to tell me how to live just like they would. It ain't their business, but they in it, I don't know why. Revolved around my life after I found another.
Assalamualaikum warahmatullahi wabarakatuh. We are students from Record Management will be present about health technologies of an organization which is CT scan. CT scan is stand for computerized tomography scan. CT scan combines a series of X-ray taken from different angles around your body and use computer processing to create cross-sectional image of the bones, blood vessels, and tissue body from our body. A CT scan has many uses, but it is commonly used to examine people who may have internal injuries or other type of trauma. Besides that, CT scan also used to visualize all of the part of our body to diagnose disease and as well as to plan surgical or radiation treatment. As we know, CT scan provide more better image than plain X-ray do.
Next is the use of CT scan. CT scanner use a motorized X-ray source that rotates around the circular opening of donut-shaped structure called a gantry. The patient lies on a bed that slowly moves through the gantry while the X-ray tubes rotates around the patient. CT image allow radiologists and other physicians to identify internal structure and see their shape, size, density, and texture. CT scan takes picture of internal body structures. In conventional X-rays, the structure overlap. For example, the ribs overlay the lung and heart. In an X-ray, structure of medical concern are often obscured by other organs. CT scan can be used to identify disease or injury within various regions of the body. For example, CT scan has become a useful screening tool for detecting possible tumors or lesions within the abdomen. A CT scan of heart may be ordered when various types of heart disease are suspected.
CT scan can help an organization in various ways, such as determining when surgeries are necessary. A CT scan can determine when surgeries are necessary by providing clear and specific information on the location, size, and shape of the target area, such as a tumor, infection, or blood clot. This can help the doctors decide if the condition can be treated with other methods such as medication, radiation, or if surgery is the best option. Next, reduce the need for exploratory surgeries. A CT scan can also reduce the need for exploratory surgeries, which can lower the risk of complication and save time and resources. Besides that, improving cancer diagnosis and treatment. A CT scan can improve cancer diagnosis and treatment by providing clear and specific information on the location, size, and shape of the tumor, as well as the blood vessels that are feeding it. This can help doctors decide the best option for treating the cancer, such as surgery, radiation, chemotherapy, or targeted therapy. Furthermore, reducing the length of hospitalization. One of the benefits of CT scan is that they can reduce the length of hospitalization by providing clear and specific information about the internal anatomy and the extent and location of any medical problem. This can help doctors to determine the best treatment and avoid unnecessary surgeries or procedures. CT scan also provide benefits to society. CT scan can help treat disease in the early stage by detecting and diagnosing the condition of patient before it becomes more advanced and difficult to treat. For example, CT scan can catch 70% of lung cancer at an early stage, which can greatly improve long-term survival chances. CT scan can reduce the number of patients in the society by improving the diagnosis and treatment of various medical conditions such as cancer, injury, cardiac disease, and stroke. By detecting and treating this condition at an early stage, CT scan can help save lives, improve quality of life, and reduce the need for more invasive and costly procedures. The CT scan can provide detailed information about the disease to the patient by showing the location, size, shape, and extent of the abnormality. This can help the patient and the doctor to understand the severity of the disease, the possible complication, and the best treatment option. The CT scan can also help to detect any changes or progression of the disease over time and to evaluate the response to treatment.
Impact of CT scan. The first one is radiation. Compared to other diagnostic tests, CT scan deliver a relatively high dose of radiation to the patient. While this is not usually a problem for a single scan, patients who need to undergo repeated tests can be subjected to a significant level of radiation, increasing their cancer risk. Second one is allergic reaction. Patients who undergo a CT scan often receive a dose of what's known as a contrast material containing iodine. This allows specific areas of the body to be highlighted on the scan. Some people can have an allergic reaction to this, and this is the most common side effect of CT scan patients complain. System can include a metallic taste in the mouth, itchiness, hives, and shortness of breath. Contrast materials without iodine are available and are becoming widely used. So the last one is misinterpretations. Because of CT scan is so detailed, it can sometimes alert doctors to minor abnormalities in the body that don't have symptoms related to them, and this is the normal course of life would not have caused the patient any problems. However, doctors may feel the obligation to divulge this information to patients, which can cause anxiety and possible unnecessary follow-up tests or treatments.
CT scan can be relatively expensive, and the widespread use of these imaging studies can contribute to rising healthcare costs. Next, ionizing radiation used in CT scan has the ability to damage cellular DNA, and high doses or cumulative exposures over time are known to increase the risk of cancer. Furthermore, the primary concern is the exposure of the developing fetus to ionizing radiation from the X-rays used in CT scans. Ionizing radiation has the potential to cause harm to rapidly dividing cells, which includes developing fetal cells.
Assalamualaikum. Today we do some quiz. The question is, what the side effect of the CT scan? Who's want to answer the question first?
Let me answer the question first. The side effect of CT scan may pose a potential risk to developing the fetus. So, pregnancy women are advised to avoid unnecessary exposure to ionizing the radiation.
Second,
Besides that, CT scan use X-ray, which involve ionizing. Prolonged and repeated exposure to ionizing radiation may increase the risk of developing cancer.
okay, correct. Third,
I think CT scan can range from mild symptoms such as hive and itching to more severe patients like difficult breathing.
okay, the last one.
In my opinion, CT scan include a slight risk of radiation exposure, allergic to contrast dye, and rare cases of kidney problems.
Okay, correct. That's all. Thank you.
Everybody asking how we doing, say we good.